going to discuss differential diagnosis of diarrhea in detail. So the first thing is to know that diarrhea is such a disease characterized by frequently passing stools, lasting a few months or even years. Then you should be familiar with the factors which makes the diarrhea worse, and that factor is anxiety if diarrhea is chronic or recurrent. Now there are some important questions that you need to ask your patient before making a diagnosis. You will ask your patient what symptoms of disease they are experiencing, including changes in weight, faintness while rising suddenly, nausea, vomiting, fever, chills, abdominal pain, blood or mucus or pus in stool, changes in bowel habits, tenderness, malaise, muscle aches, joint pain, cold, skin rashes, back pain, and anxiety. You will ask how long the diarrhea has occurred, how often they experience diarrhea each day, whether they can eat or drink without vomiting, and whether they have eaten meat or dairy products within 3 days of the onset of symptoms. You will also ask the patient if they have ever had a barium enema, an X-ray of their abdomen, or any kind of exam in which a doctor inserted a small camera into their rectum. You will also ask them about any recent travel to a tropical or subtropical country. Now you will ask your patient if they and anyone of their family have these diseases, including ankylosing spondylitis, emotional problems, diverticulosis, known ulcerative colitis or regional enteritis, pararectal abscess, past gastrointestinal surgery, pancreatitis, anemia, diabetes, recurrent respiratory infections, and cystic fibrosis. Now you will ask your patient if they have been eating a lot of cereals, prunes, or roughage, which can influence bowel movements. One more important question you need to ask is if the diarrhea began fairly abruptly, if they are at risk of having caught a bug, for instance, if they spend a lot of time in daycare centers or nurseries, if they share toilets with others, or if anyone around them have the same problem. You will ask the patient if they have recently traveled to certain regions or countries, which can increase their risk of getting a number of conditions that cause diarrhea, such as traveler's diarrhea, dysentery, or giardiasis. If the patient is a child, you will ask parent about his diet, and if he had recently changed diets, how much milk he drinks. You will ask the patient if they are taking any medications, including steroids, sedatives, tranquilizers, antibiotic, antacids, quinidine, colchicine sulfasalazine, laxatives, antispasmodics, and Imodium. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes temperature, blood pressure, pulse, digital rectal exam, pushing on your patient's abdomen, thorough throat examination, weight, thorough skin examination, checking stool for the presence of blood, check stool for the presence of pus, and also check stool for presence of egg or parasites. Now, what can cause acute and chronic diarrhea, and what is typical for each cause? Well, there are different causes of acute and recurrent diarrhea, which we are going to discuss. Firstly, we will discuss causes of acute diarrhea. Now, if the patient shows symptoms like vomiting, mucus in stool, pus or blood in stool, cold, sometimes fever, typically lasts 2 to 3 days, then this might give you an indication that patient has viral diarrhea. Well, this is diarrheal infection with a virus. But if your patient has typical symptoms like diarrhea, which begins 72 hours after eating food or drinking water that makes others sick, pus and mucus, often present in stool, fever, typically lasts days, then this might be an indication to bacterial diarrhea. Well, bacterial diarrhea is caused by infection with a bacterium such as E. coli. But what if your patient is having diarrhea, which usually begins 6 hours after eating food that make others sick? Severe nausea and vomiting typically lasts up to 36 hours. Then, this is bacterial toxins diarrhea, which is eating food contaminated with toxins produced by bacteria. If the patient has symptoms like abdominal discomfort, bulky stools, weight loss, that typically lasts days to weeks, then giardiasis might be a reason to this. Well, this is intestinal illness caused by organism Giardia lamblia, usually after wading or swimming. But if your patient has typical symptoms like cough, fever, chills, hives, typically lasts up to 3 months, then this might be an indication to schistosomal dysentery. Well, this is an intestinal illness caused by parasite contracted in tropical or subtropical region. If your patient has typical symptoms like history of recurrent diarrhea, profuse bloody diarrhea, abdominal tenderness, then this might be an indication to ambic dysentery. Well, ambic dysentery is intestinal illness caused by parasite contracted in tropical and subtropical regions. Now, if the patient shows symptoms like stool may contain blood, lasts up to 2 days, then this might give you an indication that patient has traveler's diarrhea. Well, this is intestinal illness seen in travelers to Mexico and Latin America, also called Montezuma's revenge. Now, if the patient shows symptoms like cold, clammy skin, profound weakness, fainting, jaundice, and fever, then this might give you an indication that patient has malaria. Well, malaria is blood infection caused by parasites transmitted by mosquitoes present in tropical and subtropical regions. Now, if the patient shows symptoms like low blood pressure, sunken eyeballs, bluish tint to skin, lasts up to 7 days, then this might give you an indication that patient has cholera. Well, cholera is the intestinal illness caused by Vibrio cholerae, a bacteria mostly present in tropical and subtropical regions. Now we will discuss the causes of chronic or recurrent diarrhea. If the symptoms are cramping, diarrhea, constipation, minimal pain, lasts up to days, then irritable bowel syndrome might be a reason to this. Well, this is a state of alternating diarrhea and constipation occurring during anxiety. Now, if the patient shows symptoms like bloody or frequent diarrhea, frequent abdominal pain, that occurs more often at night, then this might give you an indication that patient has Crohn's disease. Well, Crohn's disease is chronic inflammation of intestine. Now, if the patient shows symptoms like low-grade fever, pain in lower abdomen, blood in stool which are small and not well formed, sometimes weight loss, then this might give you an indication that patient has ulcerative colitis. Well, this is the inflammation of rectum and colon. Now, if the patient shows symptoms like large and foul-smell stools, lightly colored, oily, weight loss, weakness, typically lasts years, then this might give you an indication that patient has malabsorption. Well, malabsorption is an inability to absorb nutrients from the digestive system, a result of bowel surgery. Now, if the patient shows symptoms of diarrhea, which typically lasts between weeks and months, then this might give you an indication that diarrhea is caused by medications, which means diarrhea resulting from certain medications, antibiotics, laxatives, quinidine, Molox, and colchicine. Now, if the patient shows symptoms like rectal mass, abdominal mass, and constipation, then this might give you an indication that patient has partial obstruction. Well, this is blockage in the intestines caused by tumors or the impaction of feces. Now, if the patient shows symptoms like long history of diabetes, often nerve damage, this is an indication of diabetes, which is disease caused by problem in the regulation of sugar in the blood. If your patient has typical symptoms like bulky stools, history of drinking contaminated water, abdominal discomfort, weight loss, last days to weeks. Then, this might be an indication to jaundice. Well, jaundice is intestinal illness caused by Diarrhea DDx. And if your patients have typical symptoms like history of recurrent respiratory infections, family history of cystic fibrosis, then this might be an indication to cystic fibrosis. Well, cystic fibrosis is a genetic disease in which children become more prone to lung diseases or infections. If your patient has typical symptoms like weight loss, usually begins after child turns 6 months. This might give you indication that child has celiac disease. Well, celiac disease is inability to digest gluten. Now, if the patient shows symptoms like bloody diarrhea, vomiting, severe weight loss, then this might give you an indication that patient has allergy to cow's milk. Well, this is bodily reaction to ingesting cow's milk. And lastly, if the patient shows symptoms like diarrhea, which is watery, explosive or frothy, and begins soon after birth, then this might give you an indication that child has disaccharидase deficiency. Well, this is characterized as lack of enzymes that acts on sugar. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required.